This is Holistic Vigilantes, hosted by Dr. Kimberly Bear and Dr. Jennifer Tippograph. These two badass dentists are breaking the mold to provide modern dentistry that doesn't compromise overall health. Determined to spread the word, the Vigilantes are kicking down the door as they bring you honest answers to hard questions. Buckle up for a wild ride down the Meridian Highway as they explore the connection between oral health and whole body health, saving the world one smile at a time. And now, the Holistic Vigilantes.
Hello, my name is Dr. Jennifer Tippograph, and
I'm Kimberly Bear.
And we are
the Holistic Vigilantes.
We are here on this beautiful Friday morning with Dr. Andrew Wong of Capital Integrative Health, who has received extensive advanced training and certifications in holistic, integrative, and functional medicine, along with training in acupuncture and meditation. He has discovered the potential for medicine to provide true health and true healing for himself, his loved ones, and his patients. Dr. Wong practices, what he preaches. He teaches and collaborates in an authentic healing process as a founder and director of the Capital Center for Functional Medicine. Dr. Wong is passionate, caring, and fun, and we are very excited to have him here today. Welcome, Dr. Andy Wong.
Thank you. Thank you so much, Jen and Kim. I'm really happy to be here.
Yeah, we're so excited.
So, Dr. Wong, is it okay if I call you Andrew?
Yeah, Andy, Andrew.
Andy. I'm a big fan of Andy's. I've known him for a while. Andrew practices primary and functional medicine, which is so exciting for me because it's very unique. And can you just describe and explain sort of what that means?
Yeah, so we talk about primary care. You know, everyone knows what a primary care doctor does. You know, they do physicals, they do, well checkups, those type of things, acute visits. So we do that as some of what we do. I think when you look at sort of chronic conditions, which really account for most of healthcare nowadays, we have to look at take a deeper dive into that. So in traditional primary care, we're really looking at, on average, a doctor will see someone for 7 minutes per visit. And I've had those experiences myself as a patient. Like for instance, in 2012, I went to a doctor, I had some GI issues, and I went for my physical, and they actually did see me for about 6-7 minutes. They gave me a Nexium prescription and told me to take that. And so I felt that was woefully inadequate, given that doctor had great training, well-meaning primary care doctor, but the system didn't really set them up for sort of adequately treating chronic, issues or things. So I ended up doing some other things like just figuring out my diet and, lifestyle and things, and didn't need to take that. So I think when you look at primary care as a whole, it's really an umbrella term. But what a lot of people think of it nowadays as is doctors kind of rushing around, seeing 20, 30 patients a day, not really understanding or getting to the root causes of disease, or more importantly, root causes of wellness, root causes of why they got disease in the first place, why imbalances happen in the first place. So that's where functional medicine comes in. So we look at functional medicine, and we practice that, sort of integrate that with primary care in our practice, looking at the why of medicine, the why of why someone might be getting something, why something might be getting things like fatigue or pain or other things. So functional medicine is really a lens through which you can practice medicine or any form of healthcare, I would say.
So basically, when you say the system, you're talking about the insurance system.
Yeah, the conventional system, the way it's set up as a factory model.
Doctors,
Sure.
they really are being forced into this. It's very, I have a sister that's a physician, and it's amazing that people are still going into it because it's so hard. So we're so lucky to have you. And then thinking outside the box, because the whole education, like you said, they gave you something to treat the symptoms, and they really didn't look at why or, what
root
else?
cause.
Yeah, like why were you having these GI issues? Because there's a reason. And then the people, I love it when they say it's genetic. But
yeah, so genetics are part of it, but certainly not the whole picture, because we know there's something called epigenetics where there's the expression of the genes, which is heavily influenced by things like nutrition, lifestyle, stress, sleep, and everything. I think the other thing to mention is that we do take insurance in our practice, Capital Integrative Health. We have a model where it's intentionally, building this community. We don't see as many patients per day as a typical practice. We do have what's called a community fee. That's sort of a fee that people can kind of contribute to, so that we can see that, so we can do some of the things that we would do that are not considered standard of care, those type of things. So, and that does allow us to practice in a model that's more synergistic with the way that we.
So more like concierge type situation.
We wouldn't call it concierge, I would say, but it is, I think, a reasonable price point where people can afford it.
I love that, because a lot of people will say
amazing.
when you go alternative, it's 100% out of pocket.
It allows us to see, I think, more people have more access, things like that, see them a little more often and things like that. So, but yeah, we're trying to make it work. It seems to be working, in our model, and I think patients really love it. So.
Okay, awesome. So I know we often see when a patient comes to your practice, what situations or what issues, or what point would you consider referring them to the dentist to maybe, make sure there's no like oral health issues affecting other areas of their body?
We refer everyone to the dentist, everyone to your practice, Kim and Jen. So I think the issue with dentistry and medicine historically has been that medicine, just like subparts of quote unquote medicine like cardiology, neurology, dermatology, they've all been artificially separated, like kind of like silos in a farmyard, kind of like, oh, there's silos here, there's different organs. We're going to pretend they don't talk to each other, but they really do, even though, in conventional land, it's sort of like you go to see this specialist for this. So you go to see for mouth issues, you go to see if it's a sore, or if it's like an issue with nasal congestion, you might go to see an ENT doctor. If it's a cavity, or if it's a mouth pain, go see your dentist also. And so there's not really that brain lighting up saying, okay, let's connect the dots here, and we know that the mouth is the first part of the gut. We know the mouth is really important in things like protecting your brain health, augmenting your cardiovascular health. And so a lot of times when we're looking into from a functional medicine perspective, which is really a connecting the dots perspective, it's like, okay, this person has inflammation, autoimmune conditions, fatigue, whatever it is. We're going to always look at the mouth and the oral cavity as one of the root causes of, on the one hand, if they get better with it, it's going to help their health. On the other hand, if it's imbalanced, that might be one of the root causes of disease for them. So we are going to really look at that as one of the first line referrals.
Okay.
That's amazing. Yeah, and just to discuss a little bit more about the brain health in terms of connection to the oral cavity, if you can just...
Yeah, so I think I shared this with Kim, but there's a study in the last decade on people brushing their teeth, and people that didn't brush their teeth versus people that brush their teeth up to 3 times a day, had much less risk of dementia. So...
Isn't that terrifying and amazing at the same time?
So I've really started to look at brushing the teeth, not as just to prevent cavities and to help oral health, but it's like, well, I'm brushing my teeth, I feel good, have a little minty taste in my mouth, using that wild mint Risewell there that is from your office there, since I'm a patient.
Yeah, we love the Risewell.
But also as I'm brushing my teeth and I'm getting my brain stimulated by the electric toothbrush, I'm kind of like, oh, this is helping me prevent dementia as well, So yeah.
No, I love that. That's such a great way to look at it.
It's your anti-aging secret.
Yeah, it's big. Yeah, I think it's a big thing, and people don't really realize that these simple habits, because a lot of people are kind of like, well, I have to do all these things and climb these mountains and really do some things that are extraordinary to get extraordinary results. Sometimes extraordinary results you get by doing ordinary things over and over, day by day, and that's building that up. Just like you're training for those marathons, Kim, right?
Yeah.
You don't like run one 30-mile or 50-mile thing and then you're just like calling it a day.
Yeah.
You're kind of like, let's do 8-mile runs, 10-mile runs, stuff like that.
Exactly. No, I love that. And it's true, because I feel like I started running when I was 10 years ago. I was 40, and I'm definitely healthier now. And I have no doubt, even my back and my neck are better. And when I see Manny Kim, he's always like, just keep running. It's like keeping me loose, and it just helps my brain, and it's just great.
So just a little tip for all your listeners out there. If you're trying to make a health change, like eating better, which we can talk about if you'd like, sleeping better, whatever it is, just do little things. Just start out small, and you can pile up those quick wins, and that'll give your brain a chance to say, hey, there is hope. There is a way to change, instead of trying to nibble off the whole, cookie right away.
So speaking of brain, if we could talk a little bit about the adrenal fatigue, HPA, axis dysfunction.
Yes.
Subject.
Yeah. So I think back in 2015, we started to rename it HPA axis dysfunction instead of adrenal fatigue. That was the old term for that. Basically, if people are feeling tired and fatigued, we think about their adrenals getting exhausted. The adrenal glands make many hormones, two of the principal ones being DHEA and cortisol. Cortisol is a hormone that's really involved with chronic stress. So if someone has, acute stress, but also chronic stress. If someone has acute stress, that cortisol will go up. The adrenaline will get kicked off by the cortisol. So you get this fight or flight response. You can kind of get up and go. You can fight that bear. You can run away from the tiger. You can argue with someone if that's what you're doing. So this is about, physical or psychological stress, raising the cortisol and adrenaline. At the same time, you have DHEA, which is kind of the counterbalance towards cortisol. Cortisol is going to raise that stress level. DHEA is going to help you recover from this stress. So I call it the 3R: recover, repair, rejuvenate. So you need the DHEA. What happens over time as we're working too hard, not sleeping enough, too much on our plate, as we all get older, also this happens, is that a lot of times that cortisol will start to wear down that DHEA a little bit, because cortisol suppresses DHEA. So DHEA goes down, cortisol goes up, the adrenals get a bit, we would call it tired. Sometimes the cortisol also goes down. So in the later stages of adrenal or HPA axis dysfunction, what you end up getting is a low cortisol and a low DHEA. And then that's when usually people start feeling really tired. Now that's sort of from a very simplistic perspective, low cortisol, low DHEA. We have to figure out from a functional perspective why someone has low cortisol, why they have DHEA. So that's where the root causes come in. Is it something very simple yet complex, like the patient is overstressed and overtired? Maybe they need to change their job. Maybe they need to get in a better relationship or something. Maybe they need to have habits or hobbies that give them purpose and joy and meaning in life that will improve their adrenals, right? We always think about pills and supplements, and we can talk about that too, but we really have to think about lifestyle first. Are they getting enough oxygen at night?
Yeah. Mm-hmm.
Sleep apnea, right?
Yeah,
that's going to drain their
absolutely.
adrenals. Are they getting the right nutrients, both in terms of foods and possibly supplements and vitamins, and are they absorbing those nutrients, and how's their gut lining and all that? So there's a lot of stuff going on with HPA.
Could that also be tied into heavy metals?
Absolutely. So heavy metals, especially we talk about, and certainly for all of those over the age of 35, including myself, I think, a lot of us anyway got fillings, so we have, heavy metal fillings, which we call mercury fillings. And, I had about 7, growing up. So I had them all taken out, replaced. I figured out, during that process, I went to a conventional dentist for some of those, and then I realized, I should probably go to see Kim for the rest. So I finished that process up at your practice, actually, I believe, and I think it's been really helpful for me. And I'm just starting to get to the point now where, I just checked my own metals, and it's pretty high in lead and mercury. So I'm doing a detox program myself.
How did you test your heavy metal?
Yeah, so you can test in 2 different ways. One is a conventional way with blood tests, which is helpful to some degree, but it tells you about what's going on the last 2 or 3 months of your life, as opposed to sort of a total toxic load, in which case you do usually what's called a Dmsa provocation test, which is a urine test that you do to look at a post-provocation urine metals level, and that's going to tell you about more like total body burden. So let's say you get your mercury fillings out, you might still have the mercury from decades of having those fillings in, so you're going to need to chelate that out. Even though you got the source out, you will have still had that residual mercury in there.
Sure.
Yeah, so people, I know when they come in to get their fillings out, I have to explain to them, I'm not removing any mercury from your body. I'm just stopping the exposure. Like, you're not going to get any more from these.
I mean, you are
fillings.
removing some of the mercury,
From their
but some of
teeth.
it's already kind of escaped
What's
into
in
their
their,
system.
what's in their organs and tissues is
That's
still
when we
going to
send
be
them
there when they
there.
leave. Yeah.
Right, and it can't be all completely removed, but if you can remove it enough to reduce some of that inflammation that's happening from excess metals, because metals can cause autoimmunity, neuroinflammation. We're actually taping this during the time of COVID, and we know that the reason why people get serious complications from COVID is actually an increase in interleukin-6 is one of the reasons, which is inflammatory cytokines, meaning an inflammatory chemical messenger. So anything that's going to raise IL-6 or chronic inflammation, whether it's chronic physical stress, insulin resistance, but also heavy metals would be a big factor too. So bringing that level down is unfortunately not something that's really checked a lot in primary care.
That was going to ask
You
you,
would say
like,
it's
how many
underused.
and how many of the many disorders that you treat would you say could be connected or affected by a heavy metal?
I'd say just ballpark, probably 3/4, would. Just off the top, I know that research has shown that for lead, for instance, a lot of people are high in lead. And that's another thing, especially when you're talking about, especially women, but also men with chronic steroids, they're going to be at more risk for osteopenia, osteoporosis. Lead actually gets into that cellular matrix where the minerals are to build that bone up, and it's going to displace some of those minerals. So it's actually going to help to cause osteopenia, osteoporosis. So lead is another big factor too. So and lead also, just to kind of bring you back to that point of what's causing what. Lead is estimated to cause 16% of all cardiovascular disease, and we're not checking that.
I know, that's crazy. I always think about
They
how
check it in
many-
kids, but like
how many mood disorders and other are really just people are going through their entire lifetime being treated with medications, and really they just have a heavy metal load.
Yes, and I'm not an expert on autism or those type of aspects, but we know that there is some, I think, potential connection anyway between metals exposure and neuroinflammation and gut dysbiosis and all these things. So
Wouldn't you, if you could choose, don't you think it should be part of a physical? Like how much every couple years, or let's say every 10 years or 5 years?
we check metals every year on everyone. We check their
That's
on
so
LabCorp.
great.
It's a LabCorp test actually.
And it's not even is it an expensive test?
I don't think so. I mean, most people that come to our clinic, probably 99% of people have some sort of insurance. So it doesn't seem to be, but I guess I don't know because I don't know all the insurance prices and stuff. But typically what we're going to see, and the other thing about lab work, which if we can get into that for a sec, is that when you check labs and you get those labs back, you have to understand what is an optimal range, because LabCorp, I would say, or I would just say conventional lab ranges are not accurate in terms of trying to optimize health.
Yeah. No, I totally agree.
Yes.
I know.
Yeah, we talk to people
bring
all
in
the time.
the results and are like, see, I'm good. And I always look at it.
Yeah, but there's
Right.
a low side of normal, high.
There's an
side of
average,
normal.
there's an American average, which isn't necessarily
So
good.
I believe like for mercury, the LabCorp range is anything that is 15 or under. 15 or under is considered normal. 15 is very high.
But don't you think that they got that average from the average in America? Like, where did they get these numbers?
They did it from like mercury, acute mercury poisoning or acute lead poisoning and stuff like that. And that's another piece too, is that this is something crazy that I heard on a podcast, is that basically LabCorp, I would say, and other labs potentially too, we know about environmental pollution causing things like sperm motility and numbers and, fertility issues. And basically some of these plastics and environmental toxins in the environment are decreasing our testosterone, decreasing some of the hormones.
Yeah.
They're endocrine disruptors, they're impacting estrogen, they're impacting fertility, they're impacting testosterone. And for men, what's happening is the testosterone levels on average in America are going down. And so what LabCorp decided to do about 5 years ago is they said, we're going to move the range down so that we can make normal here. So now, I mean, if they look at a normal level, we can't assume that that's healthy anymore.
How disturbing is that?
I know, it's so disturbing.
disturbing.
So if we as a population on the whole are unhealthy, but normal means whatever is common, that is not a healthy.
So what we consider healthy is like 10 years ago was close, a millimeter from death. We're just getting healthier.
We probably have to be in like the top 10% of the quote unquote lab range to be really healthy, if we really want to be honest with ourselves about it.
Yeah.
90% of people in America are having metabolic syndrome.
That's
a big thing, yeah.
Yep.
Okay.
Yeah.
What is metabolic syndrome?
So technically it's defined by different lab values like high triglycerides, low HDL, high body mass index, things like that, high blood pressure, high glucose. But ultimately what it is too much fat in the wrong places, visceral fat, belly fat. We all know people that have, gut issues, maybe go to the beach, you see someone, you're like, I'd rather not see that person, on the beach because of fat, And, I think we've all been there. I gained some weight during COVID. I had to just figure out.
I'm so pale. My children tell me to cover myself on the beach. They're just like, you're blinding us. Like.
So I think metabolic syndrome at the core is having too much energy stores, but not the metabolic flexibility, not the flexibility biochemically to utilize those energy stores. So in other words, someone has too much fat, it's in the wrong places, they can't utilize it. And that ends up causing chronic inflammation, which is the root driver of most chronic illness. So metabolic syndrome, in a way, it means that we can take the sort of the traditional approach first, and kind of what we think of as the traditional approach, which is like there's too much energy stores. We need to get that out of us somehow. We can use fasting, we can use low carb diets, we can use supplements like berberine, we can use medications like metformin. So there's different things to do for metabolic syndrome. I think at the end of the day, we're probably feasting too much, if you think about eating. And for everyone listening, if someone has an eating disorder, don't follow this advice. This is not official medical advice anyway. But, if someone has the eating disorder, I don't want them to go fasting.
Yeah.
That's a big thing. That's important. But if someone is, say, eating sort of on a regular basis without doing much fasting or much sort of variation in their diet, then what that is signaling to their body is that there's a feast mode going on all the time in their body. And the hormones that are involved with that are cortisol and insulin. So insulin is that hormone that we used to think is basically a hormone that is an escort for glucose to get that glucose inside the cell, right? We need that for energy, like when you're running, when you're doing a marathon, you need to be having that glucose so you don't get hypoglycemia. I'm not as accomplished as a runner as you, but I remember like running from, like say Silver Spring to Georgetown, and it's like, I started getting dizzy. I started noticing, hey, I have some hypoglycemia. So you need enough insulin in there to bring those glucose molecules into the cell so that you don't get dizzy, so you don't pass out and things. So, but that's what we think about insulin as. But really, insulin also does many other things to the body, changes gene expression, especially in terms of things like fat storage and other hormones. Insulin will increase inflammation, insulin will increase oxidative stress, and basically insulin will increase fat storage. And this is important if someone's trying to lose weight. A lot of us are trying to lose weight, and a lot of people have metabolic syndrome. If their insulin level is too high, doesn't matter what diet they're on, they will not lose weight. So the insulin has to go down. So people really have to work with practitioners that are knowledgeable about how to guide them to reduce insulin.
All conversations and information exchanged during participation of the Holistic Vigilantes podcast or interaction within the social media umbrella of the Holistic Vigilantes pages are strictly for educational and entertainment purposes. Back to the show.
Because most people have insulin too high. Yeah.
That you could, if they're coming to see you or one of your colleagues, to reduce insulin if that's their problem.
Yeah, I mean, we have a team approach in our practice. We usually send people to our functional nutritionist would be one way. We have some group classes as well, group visits. But I think one of the keys is we have to figure out which foods raise insulin and which do not. So this is where the fats conversation comes in. So back in the 1970s, there was the rise of Oreo cookies and low-fat diets, and basically fat's bad for us. Fat's going to cause heart disease. Fat doesn't cause heart disease, right? Fat that's inflamed in the setting of vascular inflammation can cause heart disease. But fats in themselves, you need fats for hormones. You need fats for your brain health. You need fats for fertility, right? How many people are out there that are trying to lose weight? They're too skinny. They're not ovulating. They can't have babies because they don't have the cholesterol. They don't have the hormones. Cholesterol is a parent for DHEA, for cortisol, for testosterone, estrogen, progesterone. So if the parent isn't there, you're not going to have the kid hormones, right? So you need enough cholesterol. You need enough healthy fat. And some of that healthy fat is cholesterol. You just can't have an inflammatory environment because that's going to inflame the cholesterol and basically rust it, which will cause vascular inflammation and heart disease. So cholesterol in the setting of an anti-inflammatory body is great. You're going to have good health and all that stuff. So you need fats because fats are the one macronutrient that do not raise insulin, right? Protein raises insulin to some degree, and then carbohydrates raise insulin even more. So if you're trying to lose weight, one of the things that you have to figure out is on your plate, how much is fat, how much is carbohydrates, how much is protein. And I've started experimenting myself a bit with this, and this is just something that a little bit newer that I'm trying to do is food combining. If you're eating something with protein, are you going to want to eat a lot of carbs with it? Probably not if you're trying to lose weight. If you're not trying to lose weight, sure, go for it. If you're trying to recover from a run, you need to rebuild those amino acids up. You need to get that energy back up, do that. But if you're trying to lose weight, you don't want to combine too many insulin-promoting foods. So not too much of a burger fries, situation. Maybe it might be better to have a steak with a salad, right? Because your steak's going to increase that insulin, but it's also going to give you protein, promote satiety, meaning like feeling full. And then your salad's going to give you the greens, which is going to neutralize some of the potentially inflammatory effects of things like meat, which I think meat is a healthy, food to eat, just to be really clear about it. I think when you balance out meat with vegetables, that's probably the optimal way to do it.
That's great. Yeah. And just tying back to your community approach, when you say, people getting together and these like group classes, is it online, in person?
We do it all online.
That's great.
Yeah, group visits.
That's great.
It's really helped a lot.
That is great.
Yeah.
And then one last thing I'm a little curious about is how your treatment of or thoughts on acid reflux.
It's a great topic. Well, I think Nexium and some of those PPIs, like the doctor back in 2012 gave me Nexium as, the purple pill thing, if you remember those commercials, and they'd say, go to purplepill.com, it's purple. Purple's a great color. I mean, it's like a royal color. What could be bad about it? So marketing is, the marketing for these pharmaceuticals are pretty slick, because the thing is, it hijacks our brain. It kind of is like, okay, purple color, it's healthy, it must be good for us, looks like an eggplant or something, So to get back to the question, reflux, most reflux is actually caused by low stomach acid, not high stomach acid. So let's take a deep dive into the physiology on that. So why would taking a purple pill like Nexium or other proton pump inhibitor help someone with reflux? Because it's true, right? Yeah. The symptoms get better. Yeah. So this is what's happening as we all get older, as we have some chronic stresses, and maybe other things like H. pylori, which is a gut infection that helps deplete acid. There's low stomach acid in the stomach. And that low stomach acid in the stomach does something to what's called the lower esophageal sphincter that separates the esophagus from the stomach. So low stomach acid leads to sort of less competence of that sphincter. So that sphincter opens up, and that acid goes up to the esophagus and even up to the voice box. It might cause hoarseness, might cause a bitter taste in someone's mouth, like when waking up. But it could also cause like heartburn symptoms and these like very typical
dental issues.
Dental issues, right?
We see it all the time.
Enamel, right?
Wearing away of the tooth structure.
We see it all the time. We're always referring out for that.
So some people have silent reflux where they don't have these heartburn symptoms, but they have dental issues. And so what's happening is that it is true. There might be too much acid up here, but it's because there's too little down here. So interestingly, I'll just give you a nice case example of this to show that it's never too late. So we had a woman in her 90s that came in a couple of years ago, and she came in with acid reflux. She's been on a pill, the purple pill or PPI, for 40 years. She's in her 90s. And so we're like, we don't think it's ever too late. Let's check this out. Your physiology is working fine. She's healthy. overall, it's just she wants to get rid of this pill. She has this reflux. She's like, hey, what's the root cause of this reflux? So we said, well, 9 out of 10 times is low stomach acid in your stomach. And so you've just been popping this pill for 40 years to try to control these symptoms, whereas the root cause is really low stomach acid. So we actually started to wean her off that with some herbs, licorice, DGL, which is a type of licorice, maybe aloe vera, and slowly got her off the PPI. And lo and behold, after a month, she did not have any reflux anymore. And we actually gave her stomach acid. We actually supplemented with her with what's called betaine HCl, which is stomach acid. So the treatment for her reflux was giving her stomach acid.
Yeah, no,
Mm-hmm.
I love that. Yeah,
Yeah.
I see it. I have so many patients on these meds, and yeah.
It's interesting when we do our patient screening, the medical dental history, a lot of times the acid reflux linked with clenching, grinding, sleep disturbances. It's all this like big picture.
Yeah.
So it's just,
Yeah, it's totally fascinating.
yeah, very.
So, and then I guess the
Interesting.
last thing we wanted to talk about was I was on your website, which is Capital Integrative Health .org.
CIhealth.org.
Yeah,
Yeah.
CI.org.
Beautiful, by
It's
the
an
way.
amazing site.
Yeah.
Thank you, Jen.
Everything
Yes.
on there is you guys have a store on there, which makes it so easy for people, and a whole protocol for building up your immune system pre and post vaccination, I guess, with the whole
Yeah.
COVID vaccine going on.
Yeah, sure.
So any thoughts on that?
Yeah, absolutely. So I would say that, a lot of times for people, they're having, good results with vaccines. There's some, effectiveness that's, with vaccines for a lot of people. I think what's happening for some people that are getting reactions, because I think that's why we built this protocol, is that, sometimes you can get inflammatory reactions from vaccines. Just like you can from COVID infection. What usually happens, what I used to tell people is that with infection or vaccination, you will often get what's called an increase in IL-6. Again, going back to that molecule, that's one of the drivers of inflammation. So interleukin-6 or IL-6. It's not easy to test that in the bloodstream, just for your listeners, but you might know it from, maybe they had a reaction, like they had joint pain or fatigue, or even like feeling, that's where people are kind of concerned about myocarditis, like that heart inflammation. They might start getting palpitations. That's also IL-6. So what we think about is, how do you mitigate that? How do you mitigate that reaction? How do you make it so that it's safer? How do you make sure that your body is reacting in an appropriate manner but not overreacting? So it goes back to what's called immune system balance in a way. So you want what we say is a strong immune system, but also a balanced immune system. You don't want a strong but over strong immune system where it's not balanced, because that's where you tip it over into too much IL-6. So in terms of the protocol, we would typically recommend some vitamin C, some vitamin D, glutathione would be one for sure. If someone's having sleeping issues, definitely melatonin would be helpful, because it's a sleep onset hormone. It helps regulate their circadian clocks in your body, so that you can fall asleep. But it also helps as an antioxidant. It helps as an anti-inflammatory. So melatonin is a big one too. We'll do some IV nutrients often for people pre or post vaccine. So usually within the first 2 days or so before or after vaccines, and people have done really well with that.
And then, so you guys have this whole IV nutrient thing set up, which I'm a huge fan of.
It's amazing.
Can you talk about some of the, like, people come into your office, they make an appointment, and you sit in a very relaxing environment, and you have an IV placed in you, and for average of what, like 45 minutes, an hour?
I would say an hour, just to be on the safe side. Yeah.
And then, like, can you list off like a few of them, like your favorites maybe, that it's like a little, like going to get a facial or something.
Yeah. First of all, our nurses are great. They really provide a lot of healing and care to the patients. I think that's a big part of it. You are sitting in a nice, relaxing chair. When I'm sitting there, I'm like, oh, I feel like I'm at the beach or something, wherever your favorite place is. That IV is really helpful to accelerate healing, whether it's something acute like trying to get, before a vaccine or after that, recovering from surgery post-operatively, things like that, recovering from infection, but also more of the chronic issues too, whether it's chronic fatigue, fibromyalgia, those type of things, looking at that. So I think for a general immune boost, typically we're going to be doing some vitamin C, which is also called ascorbic acid. We're going to do B complex, B12, zinc, glutathione, and magnesium. Magnesium is a big one because a lot of people are low in magnesium too.
I'm a huge fan of IV nutrients because I remember doing my first Myers cocktail, which is sort of what you just described. My father, this was maybe 10 years ago, my father was dying. He had cancer, at the very end, and I was having to fly out to Kentucky every weekend to see him, and I couldn't go if I was sick. And it was in the spring, and I always used to get chronic sinus infections and stuff. And so I looked into this, and I started to get these Myers cocktails like a day before I would leave. And I was doing it. So I was getting one every week because I was going to see him. And that was the only spring I ever went through, and I didn't get sick once, which was amazing. And I was hooked. And then I started using it for if I'm going to run a marathon, I would go get one ahead of time and then one after. Or if I'm going through something really stressful, because I know my body is, I'll go up and deal with it or take that exam or do whatever I'm doing, and then I'll crash and I'll get sick. But yeah, that I am a huge fan. It's just and I always feel so good when I come out.
Yeah, so I have 2 comments about that. I mean, that's really great. Maybe 3 comments. One of the things is that IV vitamin C in general is concentrated in the adrenals. That's one of the places that needs it the most. So when someone is stressed and the adrenals are working harder, you need to give more fuel to that adrenal. So vitamin C would be really helpful there. The other thing is that, since we're talking about COVID as well, if someone has any virus, the white blood cells need to kind of mobilize to go to those areas to fight off that virus. And white blood cells also need vitamin C, as much as 10 times the baseline requirement when someone is fighting a virus. So that's really important. I've noticed for myself, when I take vitamin C, I don't get as many infections, same thing. Like, for instance, I used to work at the hospital, and, at the hospital, of course, this is like pre-mask, where people are, getting in there with pneumonia, like coughing in your face, So, all my other hospitalist colleagues and friends, they would get colds in the winter, and I was taking vitamin C and I wasn't getting colds. So that was my first lesson into that. But yeah, I think IV vitamin C has been a real, benefit for a lot of people. We've definitely seen that in our clinic as well.
Awesome. Well, thank you so much.
Thank you so much.
This was
You're
amazing.
And I can't tell you, I send patients to you all the time. And I'm a huge fan.
Thank you so much.
Yeah. Everybody go see Dr. Wong, Capital Integrative Health.
You guys have a lot of great practitioners over there.
Yes.
Yeah.
Shout out to all of them.
Yes.
For sure. All right.
Thank you.